Click OK.
Hey, everybody. Welcome to Medicare Topics. I'm Rob with the Wachter Group and Helen Adams Realty, and I'm here today to try to help bring some clarity to a very confusing issue for a lot of folks, which is Medicare. Some of you may ask, why am I talking about Medicare? I'm in real estate. Well, I'm a seniors real estate specialist, so the majority of my clients are over 55. So this is a topic that not only is potentially good for them, but is creeping up on being something I've got to deal with very soon. So thankfully, I have a couple of great professionals here with me today. I've got Sydney Hartnett and Sal Marafiotti, and they are professionals and agents specializing in healthcare and Medicare, and they are here to help make things simpler. I know that just enrolling in your health insurance with your company is one thing, but Medicare is a little bit more confusing, wouldn't you say, Sal?
Yeah,
Okay.
it's
So
a,
I'm going
it's
to
a
let
lot
them
to, a lot to deal with.
I'm going to let them take over and they're going to go through some tips and tricks. And if you have some questions, please put them in the comments. If you're watching this live, we'll get to them on the broadcast. If you're watching a recording of this, we'll get to you directly for answers with those questions. Thanks very much. Take it away, guys.
Right. Thank you, Rob. So my name is Sydney Hartnett, and this is Sal. We are both independent insurance agents specializing in health and Medicare. Sorry, I'm having some technical difficulties here. There we go. So today we're going to go through and just do a deep dive into Medicare. It is a very confusing subject, not just for those who are turning 65, but even for those who are 70 and have never actually sat down with somebody to do a full deep dive and review. And that's something that we pride ourselves on and really take time to do. So let's get into it. Let me hide this here. Okay. Perfect. So important dates to know. Right now, we are actually in the annual enrollment period. And so that means you can make changes or a change to your Advantage or drug plan. And so a lot of times Advantage plans will have a built-in drug plan, but sometimes you may be on a supplement or have TRICARE, VA. And so you will only have that MA Advantage plan. But October 15th to December 7th, you can go through, review your plan, see what's changed for the next year and make sure you're where you need to be. And then open enrollment is January 1st to March 31st. You can't do anything with your drug plan. You can only make one change to your Advantage plan. And so that's kind of a time where if you realize the Advantage plan you chose during annual enrollment isn't working for you, you can go through and make a new change. Sal, do you want to take that away?
So hold on one second. Okay. So the biggest thing that people have to come to understand with Medicare is it does not work like you're used to with your group insurance or even if you're on the Obamacare. Medicare works in 60-day benefit periods. So the you may go into the hospital, and if you're in there, you pay a flat fee, flat copay for being in the hospital, and that covers you for the first 60 days. But if you come out of the hospital and more than 60 days pass before you go back in, you start a new benefit period, and your copays and coinsurances start all over again. So that's one of the most shocking things that I tell people that are on Medicare 10, 15 years, and they don't realize that's how Medicare works. So if there's more than 60 days between your hospital stays or your skilled nursing, you're going to move into another period.
And so that is a lot to do with Part A. So when you think Part A, you think hospitals, they pay for the medical care and services furnished by Medicare certified hospitals, skilled nursing facilities, home health agencies, and hospice. And so when you think skilled nursing facility, that's where you're in there recovering. Think nursing home, but not permanent. You're not living there. It's a temporary recovery. And home health is when you have that home health care in home, but don't think personal care, think medical care in the home.
So a good example would be
A lot
you
of
come
people,
home from a surgery and you need bandages changed consistently. That would be an example of home health. If it's not being done by an actual doctor, a registered nurse, or a certified physical therapist, it's not medical, it's custodial care.
Okay, thanks.
And so Part B, think doctor. That's really the most simple way to think about it is you have those outpatient services. So you're thinking colonoscopy or some procedure in an office or in an outpatient hospital. Think doctor visits and any drugs administered by a doctor while you're in or at the facility. So think those shots that you have while you're in the doctor, they have to administer it to you. Okay, I'll move us over. And so a little bit more into Part A. This is basically visualize how it works with the numbers. And we'll say you'll still see 2025. The 2026 numbers have not been published yet. And so, like Sal said, you pay that flat copay for the first 60 days. And then you're going to 61 through 90, you're paying another one. And so it works in those benefit periods where that's what you have to pay. And if you're out of the hospital for longer than that, for longer than 60 days, you're going back in and you're looking at another big bill. And you do have 60 max lifetime days. So if you were to go over these 90 days here, 150 days here, you have a lifetime max of 60 days. Let's say you use 4 of those, right? You go back and now you have 56. And so that's something to think about. Really, if somebody's in the hospital for that long, it's pretty bad.
Let's
But
face it, if you're in the hospital longer than 90 days, you're probably not coming home. I mean, that's just the reality. I mean, that is a long, long time. Even during COVID, most people didn't cross that time frame in a hospital. So, but you do need to wear, like if you have a 100-day hospital stay, 10 of those days occurred beyond the 90-day slot, you've used 10 of your 60 days.
mhm,
Okay. And after 150 days, Medicare basically gives up on you. So if you're still in the hospital after 150 days, Medicare says, kudos to you, 100% of the bill is on you from now on. So those are things to know. Skilled nursing is what we talked about earlier, right? That's going to be you go to the hospital, have a stroke, have a heart attack, whatever it is, and you have to go to rehab afterwards. Um, think rehab is your physical therapy and occupational therapies happening as an inpatient someplace in a skilled nursing facility. Medicare is going to pay 100% of the first 20 days. They're going to cover you up to 100 days, but at 21 to 100, you're paying $210 basically a day. And that's why so many people have a dramatic recovery on day 19 because they realize Medicare is going to stop paying and suddenly you're healed and you can go home. So that's because they know most people can't afford that kind of care.
Gotcha. So can I ask a question, Sal?
Sure.
The $1,600 for the copay for the first number of days,
Mhm.
is that regardless of the number of days you're in the hospital? So if you're in the hospital 2 days, is that a copay? But if you're in the hospital
If you're in a
22 days,
hospital for one day, you owe that 16. If you're in there for 60 days, that's your copay. And
got
if
it.
you're in there for one day and you pay that and you come out and 2 months, 2.5 months later, you go back in for the exact same problem, you pay it again.
But if you go back a week later, then
Then
it's
you're in the same
still
60-day
covered.
benefit period,
Got it.
mhm.
but the
That
count
makes
picks
sense.
up where it left off.
That makes sense.
Part B is all your outpatient stuff that Sydney talked about earlier, right? This is the common things here: your doctor visits, your immunizations, right? Your
Mhm.
vaccinations, lab tests, MRIs, CAT scans, X-rays, all this urgent care, all the different things that people do from day to day that requires medical care. Outpatient surgeries would be covered here, so
Mhm.
that's another big thing, right? So um, you know this year in 2025 your standard premium is $185. Your premium could be higher because Medicare looks at your tax return from 2 years ago to determine what you should be paying now. That can be appealed. So that's one of the things I do point out to people. If you are experience a permanent, can't be from capital gains, but if 2 years ago your income was high and you've since retired or changed jobs or whatever, and your income is going to be permanently lower, you can appeal that IRMA is what they call it, income related monthly adjustment. You can appeal that and get that thrown out or reduced. And then you have a Part B deductible. This year it's been 257. So the first time you try and do anything that's covered by Part B, you pay that 257. After that, Medicare is going to pay 80% of the allowable amount. You pay 20% plus, here's a good surprise for you, any excess. And most people are not familiar with what happens with excess. So any provider who accepts Medicare, Medicare allows them to charge up to 15% above whatever Medicare says is the appropriate fee. So if you go to a doctor and they say, Dr. Sal, we pay $100 for that, I can say, well, that's fine with you. I'm pretty proud of myself. I'm charging 115, right? So, or if the fee was 500, I could charge 575, right? It's 5,000, I can charge you 750 extra. This is all excess, and Medicare doesn't cover the excess. Medicare covers 80% of the allowable amount. You cover the 20% and the excess.
And that can be pretty big for some people. And so talking more a little bit about what Sal touched on with the Part B premium by income, like we said, the standard for 2025 is 185. And most people do pay that standard amount, but it is based on that income from 2 years ago.
And that's
And if
per
you're
month, right?
Yes, that is
yes, the Part B premium is per month. Yes.
the rumor is, and we don't like to talk rumor, but since they're taking so long to tell us, the agreed upon rumor is that it's going to go to 206. Now, that being said, every year the experts always start posting on what they are 100% sure it's going to be, and they're never right. It was supposed to be 195 according to them. This year it was 185. So hopefully it won't be 206, but that's the estimated amount.
Right. And like Sal said, we don't necessarily want to go off of the estimated amount. Um, but yeah, just like Sal talked on, you're looking at the modified adjusted gross income. And so they're going to look at it from 2 years ago. And some people may pay more for Part B depending on their income.
And just real quick before we go to the next slide, that IRMA not only affects your Part B as in boy, it also affects your Part D as in drug. So both of those premiums are given a IRMA monthly adjustment. All
Got it.
right.
So there's three ways to tackle these patient out-of-pocket costs that Medicare doesn't pay for covered services. So out of your own pocket, which nobody ever wants to do, especially in this economy, right? Or you can go ahead and purchase a supplement plan, aka a Medigap policy with a standalone Part D drug plan, or you can sign up for a Medicare Advantage plan. And like I mentioned earlier, for most people, that drug plan is included unless you have some other type of coverage like VA or TRICARE. And other than that, really, you want to make sure your drug plan is included. And so a Medigap plan it works with your original Medicare, so your red, white, and blue card. And like a horse and buggy, wherever your Medicare card works, your Medicare supplement works. And it picks up most or all of the amounts left by original Medicare. And the red numbers from our previous slide, that's what you want to refer to of those amounts. And so if the horse won't go there, neither will the buggy. That's something to think about when it comes to your Medicare supplement plan.
Cosmetics a good example, right? You want Angelina Jolie lips, Medicare is not going to cover that. Okay. So if your Medicare A and B doesn't cover it, your supplement doesn't. They're tied together. Okay.
Makes sense.
And if the doctor hospital accepts Medicare, then you can go. And so that's something to think about too. And that's a question we get a lot, I would say, is, well, can I go to this doctor? And I say, do they accept Medicare? Yes. Okay, then yes, you can go. And so that's really not necessarily a confusion, but that's a big question that's typically asked.
What percentage of doctors would you say don't accept Medicare?
If you're George Clooney and you're going to the doctor, you're probably going someplace where those kinds of facilities, if they get any kind of government funding whatsoever, they have to take Medicare and Medicaid. So it's literally less than 3% of the facilities nationwide that don't accept it. Now, there's also a big trend with these uh, senior practices. WellCare is one of them, Archwell, different things like that. They do not take the red, white, and blue Medicare. They only work with Advantage plans. So you would not be able to use your supplement there. So there are practices, this new fad popping up of senior-centered providers that do not take original Medicare. They don't take the red, white, and blue card. They do take the Advantage plans. Okay.
But back to Medigap plans. So basically, this is another layout of how they work, right? You'll see some of the plans do cover some things and some don't. And the reason we have G covered is it's really the one that covers the most. It covers the excess charge that we just discussed. It covers that Part A hospital cost up to 365 days, so it extends your time in the hospital. Part B co-insurance, co-payments. So think doctor office, those co-pays and co-insurances that you're paying that 20%. The first 3 pints of blood, Medicare does not cover, but Plan G will, and the other ones will too. Your Medigap plan will. Part A hospice care, co-insurance, skilled nursing, Part A deductible.
So the short version of G, it's the great plan. Think G is the great plan. It is the one that covers when we were on those last screens and we saw all the things that you have to pay if you go in the hospital under A, all the things you have to pay when you go into skilled nursing, all of the co-insurances and the fees that you pay under Part B, including the excess,
Mm-hmm.
G pays them. The only thing G doesn't pay is that Part B deductible of this year, $257. Give you an example, just put it because I like real things that I can wrap my head around, right? I had a lady that about 3, 4 years ago, August 1st, she went on Medicare. Put her on A and B. We got her a Part G, Plan G supplement. The 15th of that very month, she had her hip replaced. She spent several days in the hospital. She spent a week in rehab. She owed $257, okay, for joint replacement. Okay. That original Medicare with a supplement is the best coverage you've ever had in your life, and you'll never have better coverage other than that.
But it does come at a premium. And so that's something that a lot of people, people don't want to pay a lot of money, right? And so when you think about it, you're paying for that privilege. You're paying for the privilege of these being covered. You're paying for the privilege of going wherever you'd like to go. And the only thing that you really do need to remember with Plan G, at least, is that it will not be covering that deductible.
Mhm.
And so you go to have that done, like Sal said, you're paying that. And Plan F is only available to those who turned 65 and went on Medicare before 2020, January of 2020.
Okay, so that's no longer available to new enrollees.
Correct.
Exactly.
And
Yes.
even if it was, the only difference between F and G, it's not the main difference, the biggest difference is the only difference is Plan F paid the Part B deductible, Plan G doesn't.
And how much
Now,
is that deductible? Is that the $1,600?
$257 this year.
$7. Okay.
And if I were to quote you, if you were able to buy both, if I quoted you F and G, there's about a $300 a year difference in the premium. So you're paying $300 to get rid of a $257 deductible. Okay. I'm not the greatest math person, but that's bad math.
No, but I can see how it's important to seniors, especially that are, now on fixed incomes, that to have a predictable, budget for healthcare.
The top reasons that you do a supplement with original Medicare is freedom. You have freedom to see whatever doctors you want. You have freedom of care. There's nobody looking over your doctor's shoulder to make them jump through hoops to do tests and procedures, right? But it does, as Sydney said, come with a price. Because when you see all how great this is, you're like, well, why isn't everybody? Why are some people on Advantage plans? Why isn't everybody on a supplement? Because a supplement on average for a 65-year-old is going to run $130, $140, $150 a month on top of your 185. So there's the only reason why people don't do a supplement is it's just cost prohibitive for some folks
And there are rate increases as well
every year.
every year. So that's another reason. I mean, of course, it's going to be a little bit cheaper for somebody going on Medicare rather than somebody who is in their 80s on a supplement plan, right?
A lot of my clients start out on supplements, and then as they get their rate increases, they get to their rate increases. And at a certain point, it just either becomes cost prohibitive to stay there, or it no longer makes sense economically, right? It's what I call no-brainer land. Eventually, you're going to get to a no-brainer land scenario where you're paying more in premium for a supplement than you could possibly spend on an Advantage plan. And at that point, we need to give careful consideration on whether or not you should make that move. but it shouldn't be made lightly. Okay. I think we need to kind of move.
And so typically, like Sal said, there is a no-brainer land, but some people do prefer Advantage plans, and it's all preference, and they can be very cost-effective compared to original Medicare when it comes to that. But you do need to review the benefits, and all Advantage plans have copays for doctor visits, hospital stays, along with co-insurance for other services. They all cap the amount that you would have to pay in any given year for any given hospital stay. However, they do vary greatly on where they set those fees and caps, and so each insurance company is a little bit different.
That is the number one thing that an Advantage plan does for people is it puts a ceiling. Because if you go back when we were looking at Medicare Part A and B, when you look at B, you have to pay 20% of those bills. There is no cap. There is no stop loss.
Mm-hmm.
So an example would be if you got cancer and you're doing radiation and chemo and all you have is that red, white, and blue Medicare card, you're responsible for 20% of your cancer treatment with no cap. So you need to either have a supplement to protect yourself. And if you absolutely can't do a supplement, then you need to be looking at an Advantage plan so that you can cap those costs.
Gotcha. So am I understanding this right? If you go to an Advantage plan, you are actually leaving Medicare.
No, you're
No,
leaving original Medicare,
original
but you're
Medicare.
not leaving Medicare.
Okay.
You still have A and B.
So what you're doing is with original Medicare, you've got government provided insurance and then a private supplement. When you go to an Advantage plan, you're trading the government version for a private version from a major carrier, right?
Okay.
So then they're in charge of your A, your B, and your D all in one plan.
Got it.
And a lot of them offer extra benefits for dental, vision, even gym memberships, and they all have different programs. Some even have over-the-counter allotments, and so it's a small amount quarterly to purchase different supplements or different things over the counter.
Got it.
So the biggest thing to note that I want to stress is an Advantage plan is not just a different way to supplement your Medicare. It is a replacement of your government for a private version of Medicare. So a guy called me up one year and he says, Sal, I heard Medicare was coming up with their own Advantage plans. Is that true? And I said, that sentence doesn't make sense, right? You have original Medicare, which is government. You have an Advantage plans. They're both Medicare. Okay. It's just different ways to do it. And there's trade-offs. Listen, most of us been around long enough to know that when Peter hands you money, when you turn around, Paul's got a bucket, right? So if we're going to save you $140, $150, $200 a month in premium, you got to know that when you come over to this other plan, there's going to have to be some give back, right? From you. You're going to have to give. So what you're giving up mostly is freedom, right? On a Medicare, original Medicare with the supplement, you have freedom to go wherever you want. That takes Medicare. When you go to an Advantage plan, you're back to the way you were on Obamacare or in group health plans where you've got networks. You've got to stay within the networks. So Advantage plans do get a bad rap from a lot of people, mostly doctors, because they don't like them because they get paid less, right? So that's the main reason they don't like them. And they're also have somebody looking over their shoulders, questioning whether or not they're doing stuff that is necessary or not. And so there's a little bit of freedom of choice and a freedom of care that you give up when you move to an Advantage plan, but it's really, truly, honestly, no different than what you've experienced before on group or marketplace coverage.
And you do still have to pay your Part B premium, and so that's something to be aware of.
So when you hear about these zero premium Advantage plans, they're not free. You're like, why don't you just say they're free? Because they're not. You still have to pay your Part B premium in order to have an Advantage plan.
But you're
And you
paying
still
that Part
have
B
your
premium to the insurance company rather than to the government.
Correct. It still goes to the government, and then the government pays the Advantage plan carrier set fees for each person on their plan, plus they get reimbursed for the actual care provided. And that reimbursement is based on their star rating. The better their star rating, the better their reimbursement rates, which is why they all strive so hard to have good star ratings.
Got it. Interesting.
Okay.
And so original Medicare with a supplement and a drug plan versus a Medicare Advantage plan, that is really, I think, the decision that makes it or breaks it for you, but it's really based on your needs. And neither is better than the other. It's all really just preference. It's your needs, your circumstances, your usage of healthcare, your budget, what location do you like to go to, what medications you're taking. There's so many ins and outs, and it's really personalized and it should be treated as such. And so when you hear the people in your community around you saying, well, no, I would never go to an Advantage plan, or supplements are always better, supplements are awful, really, you shouldn't listen. Take it with a grain of salt, because everybody is individual and has different needs. And that's what we need to pay attention to.
Listen, what you'll do for your healthcare decisions is going to be very different than what I would do. I've had over 50 hospital stays and 23 surgeries. I think I have a different set of usage of healthcare than the average bear. So I'm going to make my healthcare decisions a little differently than somebody who says, I can't remember the last time I've been to the doctor. Okay. So you've got to take those into considerations. And what I always tell people is, your health is a lot like the stock market. Past performance, no guarantee of future results, but it's all we have to go on. How's your health been? Are you staying steady? You getting better? Or are you on a downward trajectory? We need to factor that in when we're looking at, which option is better for you. Because sometimes we look at the tree and we like the tree and we buy the tree, and then we take a step back and realize it doesn't really fit with the rest of the forest, right? So you got to make sure that it looks good up close. And then you got to step back and say, in the big picture, is this the right decision for me?
And so this is basically a little, what would you call it? A diagram
This is a no holds bar
yes, it's,
look at both options.
yep, it's,
Original Medicare versus an Advantage plan and how they lay out.
yes. And so it's a layout. It's basically everything that we went over and just laid out for you to see a little bit easier. And it's kind of not necessarily, it's a comparison. It's almost like one of those Venn diagrams. And so over here, again, you're looking at the supplement Medigap Part D. You need all separate coverages for this. There's pros and there's cons, right? It's more expensive to own, like we said. There's price increases every year. There's no dental, no vision, no drug coverage. You have to get that separately. And you still have that Part B deductible. But it is accepted by all those who take Medicare. It's very predictable. And the max out of pocket is that Part B deductible, the out of pocket cost.
Rob, you mentioned that earlier. Some people look for stability and predictability, and there is nothing more predictable. I can tell somebody who's on Medicare A and B, original Medicare, with a supplement, I can tell them on January 1st of that year exactly what their healthcare costs are going to be to the penny, not counting prescriptions, because it's their Part B premium, their supplement premium, and the Part B deductible. That is all they're responsible for. So that is their worst case scenario. On the other side, that's also your best case scenario. You're going to pay that amount every month, whether something happens to you or not. So it's very predictable. It's comprehensive. It's widely used. The only big negative is the cost, right? And that cost goes up. On your other side, you're talking Advantage plans. The number one reason people buy an Advantage plan is it's inexpensive to own. In most cases, a lot of these plans have a zero premium. So you just pay your Part B and you're on. If you're on Medicaid, then Medicaid's paying all of that and you truly don't have any costs. Okay. It also includes your dental and vision, it includes your prescription coverage, and it works similar to when you are on a group health plan or the marketplace plan. The negatives, it's going to cost more to use, so it is a little less predictable, and not everybody takes it. And you do have that extra oversight of a publicly traded insurance company who needs to make a profit overseeing your care. So that's the thing that the doctors argue the most about.
And it is something to think about with the networks, especially if you are thinking of moving to an Advantage plan. You want to be able to go through and make sure all of those providers that you use are in network. And you also need to look at where you're going, what services you're getting done. And so a lot of times people can predict, yeah, I'm going to need a colonoscopy this year. I'm going to need this or that, right? And so that's something to break down and to make note of going into the next year when you're reviewing your Advantage plans.
Gotcha.
So when we get somebody to this point and we've shown them the side by sides, the thing I always point out is this: if you're on the fence, you're like, Sal, I just don't know. I don't know. Which should I do? Which is a question you're never going to get me to answer
Right.
because what
Even
you'll do and what I do are different,
Mhm.
right? But if you're on the fence, always go with original Medicare and a supplement. And the reason is when you first enter Medicare, you have a 6 month guarantee issue period. Every insurance company has to take you, no underwriting questions, no write-ups, no exclusions, no anything like that.
Mhm.
You can always move from a supplement to an advantage plan. Every year during those dates we talked about earlier, annual enrollment, open enrollment, you can move from one to the other. Okay. But to move from an advantage plan to a supplement is going to require 2 pages of health questions. Okay. So if you don't do it
Mhm.
right away, there's a good chance. I've got 80-year-olds who can answer the questions. Okay. They're in better health than
It
any
would
20-year-old I've
qualify.
ever met. Right.
Right. But
But as we get older, our health doesn't tend to improve, right? We get more things wrong. We're on more medications. We
it's
have
just a
more conditions.
fact of
It's
life.
fact of
Yeah.
life is exactly right. So it's going to be much more difficult to move from an advantage plan back to a supplement or to a supplement for the first time.
Yeah. So you're saying that the day you turn, is it 65?
It's actually the
It's
day
first.
you get Part B. So some people um, will turn 65, but they're still working and they're still on their group health plan. Okay. So one of the questions I get asked a lot, people, is I heard if I don't get Part B right away and Part D right away, I'm going to get a penalty later. That's true unless
Mhm.
you're covered by a group health plan. So when you get Part B, as in boy, that day starts a 6 month clock. From that day to 6 months later, every supplement company has to take you, no questions asked, not even tobacco questions, nothing. Okay. After the 6 months, 6 months in one day, 2 pages of health questions.
Okay. So if I'm not on a group health plan when I turn 65, that starts the day I turn 65.
Correct.
And if I'm on a group health plan until I'm 69, it starts the day that plan ends.
It starts the day you apply and receive Part B. So when you get your Medicare card, there's going to be an A effective date and a B effective date. Regardless of what age and why you did it or didn't do it, when
Mhm.
you get B, that starts the clock, 6 months.
So I could go uninsured between 65 and 69, and that clock won't start.
Correct. But if you do that, then when you go to get B, you're going to have a penalty for the rest of your life because you didn't get B or D when you were supposed to, and you didn't have group coverage. Those are the people that get the penalty.
Now I understand that part. Thank you.
And that penalty never goes away. In fact, it gets worse every year because it's a percentage of the current price,
It's
right?
a
So
permanent stain.
yeah,
Yeah.
it never goes away.
Yeah, and something else to touch on is protect that Medicare ID card. Protect that number, protect those dates. Don't give them out to anybody who's calling you. A lot of times, if my rule of thumb is if they won't meet you face to face or give you their national producer number, you need to hang up because it's illegal that they're calling you.
So let me just uh, this is Cindy knows this is like my pet peeve. Like
Pet peeve, both
your
of ours.
phone, if you're 60 or you're older, your phone is ringing all day long with people calling you about Medicare. And here's what I want you to know. Every single call you're getting is illegal.
Hmm.
It is illegal for me to call you about your Medicare without your permission in writing or on a recorded line. So, what you got to understand is those people calling you have already told you they're willing to break the law to get to you. What do you think they're going to do once they have you in your hand? And if you ever give out your Medicare ID number to somebody over the phone, if they have your name, your birth date, and your Medicare ID number, they can switch your plan. All they got to do is get you to say the wrong thing at the wrong time, and you will have given them permission to do so. And the big trick is they'll call you and they'll say things like, "Hey, do you want to know if you can get qualified for all this money? This is the big thing we hear. What about
Hmm.
this thing where I can get money for my rent and my utilities and all?
My
Do you want to
foods
see if you
and
qualify for that?" And who's going to say no to that, right? So you go yes, and then they go, "Well, what's your Medicare ID number? I'll check." You don't need to give them that. There's only two ways to get those services. To get money for your rent and your utilities, you have to be on Medicaid. If you're not on Medicaid and Medicare, the answer is no. And I didn't need your Medicare ID number to figure out whether you could qualify
You
for
only
that.
need that Medicare ID number when you're doing the application, the enrollment. And so to see if you qualify for that, that's besides the point of your Medicare ID number.
Yeah.
So be very careful and be very wary of those people out there making those calls.
Yeah, just don't give out your Medicare ID number.
Yes.
You need to know 100% sure who you're talking to and why before you do that.
Got it. So that brings up a really good question. So since, let's say I'm 64, closing in on 65, how do I get that number? How do I get a Medicare number?
So you're going to apply for it on the SSA.gov website, or you can go to the Social Security office. Social Security is the one who handles Medicare. They're the ones who control and get people on there. So there's two things that's going to happen. When you're turning 65, you're going to do one of two things. You're either going to take your Social Security check or you're not. Okay. So if you're going to delay your Social Security check, that's one thing. But if you're turning 65 and you're either already getting your Social Security check because you took it at age 62, 3, or 4, right? Or you're on disability, if you're already getting your Social Security check, you're automatically going to get Medicare when you turn 65. But if I'm working and I'm turning 65 and I've decided I'm going to go on Medicare, I go to the SSA.gov website. And if you haven't done that, you should create a portal now, even if you're 40, because you can go on there and see what your Social Security check looks like and when to take it and what you're going to be earning and all that kind of stuff, right? But when I go on there to apply for my Social Security check, it's going to say, hey, do you also want Medicare? Yes. Do you also want Medicare Part B? Yes. So if I'm not going to take my Social Security check at 65, but I want Medicare, then I bypass the questions and the application to get Social Security, and I go straight to apply for health care only. And then I apply for A and B, but not my Social Security check. It's important to note if you're not going to take a Social Security check, you're going to have to pay your Part B premium 3 months at a time, right? Because there's no Social Security check for them to draft it, and they don't do.
Got it.
Once you've paid the first time, we can move you to a monthly bank draft.
Got it. So it used to be, correct me if I'm wrong, your Social Security number was your Medicare number.
Yeah.
Correct. But that's not the case.
What a mess that was. We spent all that time telling people not to carry their Social Security card with them. And then we gave them a Medicare card with their Social Security number on it. They handed out like candy, right? So it's been about 5 years maybe now. They changed that. And now you get what I like to call your VIN number, right? So it's just a random number and it literally looks like the VIN off of a car. But that's the number that you'll use for all of your Medicare needs. And the one that you want to protect with your life.
Got it.
All right. You can tell this can get confusing, right? And I always say, listen, as an agent, Sydney and I cost you nothing.
Nothing at all.
Zero. There's no markup for us. There's no fee from us. It's illegal for us to charge a fee to somebody to help them with their Medicare. You don't have to pay us. The insurance companies pay us when we enroll them in the companies. You always want to work with somebody independent. You don't want to work with a captive agent who only sells one. Listen, if you go to the Ford dealership and you ask them what's the best car to buy, guess what it's going to be?
Yeah, Ford, yeah.
It's not going to be a Chevy, right? So we like to joke around. We say, we're CarMax, right? I don't care what kind of car you want. I got it on the lot. All right. So every carrier that's out there that's available to you, we have access to. So we're going to show you in an unbiased way what's your options between a supplement and an advantage plan. If you want to go to an advantage plan, what are your options in your county? Because those plans vary by county, not by state. So we got to really look. We got to look at your prescriptions. What drugs are you taking? What doctors do you see? There's a lot involved. And I would not want to be, let alone not be a senior, I would not want to be anybody who's seeing this for the first time and try and make a decision on how my healthcare is going to look for the next year on my own.
And that's honestly something that we advise against in a way. I mean, even if you're just talking to us about delaying Part B and coming back to us and wanting a more in-depth overview. For me, it's about helping people because Medicare should really be centered around you and your needs, and you should be able to understand it completely before you make any decisions. And so that's what we do. That's our focus.
Well, I'm glad you said that because it sounds like, I was licensed to sell health and life insurance in this state for over 10 years.
Mhm.
And this is very complicated even for me. So I can imagine for people that have not had that kind of training, how crucial it is for them to sit down with someone that'll actually talk them through the situation and how it affects them individually. So,
We are, we normally do when somebody's getting ready to turn 65. You qualify for Medicare the first day of the month that you're turning 65. So
Mhm.
if you're born June 30th, you go on Medicare June 1st. The only exception to the rule, because there always has to be one, is if you're actually born on the 1st. You
Mhm.
actually get Medicare a month early,
Month early.
right? So you can sign up for Medicare up to 3 months
Mhm.
before your birthday.
And it's important to look into it during that 3 months. And that way, you going into Medicare and making your decisions with plenty of time. It shouldn't be an overwhelming process.
So we tried to meet with somebody. We do an introduction to Medicare appointment, and we try and do it 3 to 3.5 months before your birthday.
Hmm.
That way you understand how Medicare works. You get this, and you can imagine seeing this if you're watching this live or the recording, when it's done and it kind of settles in your brain, questions are going to pop up in your mind. You're like, well, man, they didn't talk about this. They didn't talk about this. Well, what about this? I don't think I understood that, right? So we try and have that welcome to Medicare appointment 3 months before it's going to happen. That gives you plenty of time to get questions answered, to figure out what you want to do, and to get applied for Medicare because it takes 2 to 3 weeks from that day for you to have a card in your hand. And then we have a second meeting where we address those questions and then we help you make a decision as to which one is going to be the right one for you.
And
And
based on your needs,
yeah,
doctors, health conditions.
listen, when somebody calls you on the phone out of the blue, they're not going to do any of that. Okay. They have one goal in mind, and it isn't to find you the best plan, it's to get you on their book of business. So
mhm.
Hmm.
they're gonna hard pressure, they're gonna race through things. I can't imagine trying to understand Medicare or the different advantage plans in a phone conversation. That's why
Hmm.
we like to do Zoom because we share our screen, get to see you, or we meet with you in person. I do like phone appointments for me are an absolute last resort because I don't know about you, but if you start talking numbers to me about the fourth or fifth number on the phone, I have zoned out. I'm done, right? I need to see it.
And plus, we're relationship people. We're
Yeah.
not, it shouldn't be a rushed process. You shouldn't feel any pressure. It should be something that's catered to you.
There is no if you order by midnight tonight, you get a free gift thing here, right?
Well,
It's just,
it sounds like it's very similar to real estate. There are some real
Mhm.
estate brokers that want to come put a sign in your yard and get you out of that house tomorrow. And there are some that will consult with you about your tax consequences, where you want to live, what your long-term plan is to be there for you.
I always tell people there's a big difference between a customer and a client.
Exactly.
And that's the
Mhm.
different mindset. We're client driven,
Mhm.
not customer driven.
Mhm.
I talked to an agent one day. He said he had 2,000 clients. I said, no, you do not. And he looked at me. He goes, no, no, I'm pretty sure it's about 2,000 clients. I said, no, you have 2,000 customers and you cross your fingers every year and hope they renew because there's no way you're giving quality service to 2,000 people. Can't be done.
Absolutely.
Can't be done.
And speaking of questions, we've had two questions that have come up. They're actually
Love
somewhat
questions.
related potentially. The first one says, what happens if I'm traveling, if I'm on an Advantage plan and I'm traveling and there's not a network doctor nearby, what happens?
Okay. So three things that could be in that scenario. Let's take the big one. You're traveling out of the country. Don't count on Medicare supplements, Medicare Advantage. If you're going to leave the country, whether in a cruise or by plane, by boat, I don't care if you're going to take a paddle boat. If you're leaving the country, buy the travel insurance. Your travel agent sells it. We sell it. Heck, the guy in the corner that sells watches probably sells it. Everybody sells travel insurance.
It's important to
You
get
want to
that
have
travel
you want to
insurance.
have it, and you want one that has trip reimbursement in case you have to cancel the trip for medical or personal reason, and you want one that has repatriation because that's going to get you back home should something happen in the country you're in while you're there. Okay, where the president says, "Hey, all Americans need to get out." So that's out of the country. Um, Traveling around the country, if you have a PPO, that plan has a list of doctors, hospitals, and labs and things that you should use to get the best rates, but you can go out of network. So you got a lot more freedom when you're traveling the country with a PPO than you do an HMO. But an HMO, isn't as restrictive as you think when you're traveling, which is why we like to stick with the big dogs, the national carriers, right? Because the way it works is, remember, we said Advantage plans vary by county. So if I buy a plan and I live in Mecklenburg or Union or Cabarrus, right? And I live in that county and I'm on an HMO, and then I decide to go visit my relative or best friend in Dallas, Texas. If while I'm traveling, I have a true emergency, break my leg, break my hip, have chest pains, anaphylactic shock, car wreck, whatever, appendix ready to burst. It's
True
something
emergency.
where I can't say, hey, Rob, just chill out till you get home and deal with it then, right?
Mhm.
No, it's got to be done there. Every carrier has to deal with that as if it's an in-network event, no matter where you are in the country. That's whether you're on Medicare, whether you're on a group plan, or whether you're on Marketplace Obamacare. If you're out of network and it's a true emergency, it has to be covered. Now, what about the routine things? What if I'm going to go to visit my cousin in New York or in Connecticut and I'm going to be there for 2 months, right? And I wake up one day and it's just a horrible migraine or sinus infection or a bad rash.
The flu.
It's the flu.
Yeah.
This is not life-threatening stuff. You could just deal with it, right? But I want to go to an urgent care, right? I just want to go get this done. So the question we ask is, okay, you bought a plan with, we're not going to give names. You brought a plan with company X and you're on their HMO plan. And now you're in this county and you need to see an urgent care. Do the people in that county have an HMO available to them with company X? If the answer is yes, you plug right into that network. So you do have national coverage, even for the routine stuff, depending on where you are, and you have national coverage for true emergencies regardless.
And it's
So
work-based.
it's right. So listen, I always tell you when you're traveling, you're worried about three things. If something major happens to me, is there a hospital I can go to? And we've already discussed if it's that, everybody's got to cover it. The next thing is if it's something less thing, a little more stupid or routine, is there an urgent care I can get to? And then the other thing is, if you wake up in the middle of the night doing this, is there a dentist you can get to? Okay. Now, good luck with the dental part, right? Because if you've ever had that happen to you, you know getting an appointment as an emergency with a dentist you've never been to, especially if you're traveling and they know you're never coming back, good luck. Okay. But at least your plan, if you can get them to see you, will give you the coverage. Okay. So that's the travel question.
Okay. And the second one was, or this one was, what about, as you just mentioned, vision and dental? Are they part of Medicare?
Dental and vision is not part of Medicare. So if you have the red, white, and blue card and a supplement, you don't have any vision coverage for optometrists, like just to go get an eye exam or whatever. Now, if you have an eye problem and you need to go see an ophthalmologist, you have an eye infection or whatever, or you want to do cataract surgery, those things are covered by original Medicare. If you have an Advantage plan, almost every Advantage plan gives you a zero copay eye exam and some kind of an allowance, either yearly or biannually, for contacts and glasses.
And Advantage plans will give you that dental allowance too, but that's not to confuse it with full insurance. And so a lot of times, if depending on the plan, if you need more major work done, you're somebody who's had a lot of dental problems, it's not a bad idea to look into getting some type of dental, standalone dental, right? But you do have a certain allowance, and it's also, again, dependent on networks. There is some out of network, but it's all dependent on that rate too. So that's something to think about when choosing your dentist.
Great. All right. Well, those are the questions that we've got for today. You guys have clarified a lot of things that I had never thought about. If you're watching this, you've watched this, thank you very much for joining us. Please put some comments down here, or as you can see on the screen, there's some information there. You can contact Sydney, or if you reach out to me, I can put you in contact with them if you've forgotten how to do that. And I really appreciate you guys joining us today.
Thank you so much,
Rob.
Rob.
We love that you had us here, and we really like what you do with these talks and just covering a variety of things that are just helpful to your clients. It's very relationship, and that's what we like, because that's how we do things.
Great. All right. Well, we're going to wrap up here and hope you all have a great day.